Good morning, everyone, and thank you for joining us. My name is Jason Cogdell. I, along with Chris McCauley, am a benefits attorney for ProBenefits, and welcome you to this August session of our client webinar series. We traditionally take the month of July off as kind of a summer siesta, so this is the first client webinar since June, and thank you for joining us today. We have reshuffled our webinar topic list for August through December, in part because of recent events, to give a brief, and this will be a relatively short session today, but hopefully a helpful and practical one for you to help you as employers, and then we have advisors on the session also calibrate where we are after all of the activity in Washington over the past few months and the efforts of Congress, albeit unsuccessfully, to change, repeal, repair, modify the Affordable Care Act. So today's session is really intended as a practical update. Where do employers stand now? So I'm not going to share a lot of new material. I'm not going to give you long lists of to-do items from a compliance perspective, but rather give a quick update and hopefully a practical and helpful update on where we stand and what you as employers need to know right now as we stand in mid-August, coming to the end of the summer and heading into toward the fourth quarter and the next big benefits enrollment season. So hope that you will find this session helpful and practical as a relevant session for where we stand right now. As always, your questions are welcome. During the session, you can submit the questions through the question box. What I'm going to do today is keep the general webinar presentation fairly short, and this will probably be in the range of 16 or 18 minutes, and then I'll close that portion and then stay around for an online written Q&A session afterwards. So those of you that would like to stay and ask questions afterwards in writing, I'll respond to those, and those that will need to go, that's fine. So before I get into the ACA update, I want to give you a brief update, since we are mid-year, of the compliance tools that are available to you as an employer client of ProBenefits, whether long time or relatively new, or for those of you that are referring brokers and agents that we're working with. First of all, we do have our monthly webinars. We have at least 11 a year. Sometimes we'll have some special training sessions on particular topics. Just so you know, and I'm going to switch the slide over to the web for a moment. Hopefully this will show up clearly on your screen. On our website, if you may not can see that very clearly, but on our website, under employer tools or broker tools, there's a news and updates page with a link to our compliance blog, Elevation, as well as a link to the 2017 client webinar series, where you can see what webinars have been done earlier this year, whether regularly scheduled or special webinars. The YouTube link to the recording of those sessions is there beside each session. As an example, our June session was top 10 benefits compliance mistakes, and if you can see my cursor there in the middle of the screen, there's a direct link to the YouTube of that. If you ever want the slides, we'll be happy to provide those to you. In addition, the archive is down below on the same page where all of the 2016 and prior sessions are. So between the archive and this year's top, we cover a lot of things from a compliance perspective. And if there's any topic that you need more information on, you're welcome to reach out to me or Chris or your ProBenefits contact, and we'll do our best to provide something helpful to you in terms of a reference one-pager or something from a legal resource. Employers working with us have access to our team, our compliance team, in addition to me and Chris is the primary contact for questions and assistance. And we also do a lot of training. A lot of it is for broker agencies to assist them with training of employer clients. But if you have a specific need for your organization as an employer, we'll be happy to help you. A lot of our training is on basic topics: pre-tax benefits under Section 125, HSAs, FSAs, COBRA administration, that type of thing. But we also do a lot of advanced training for employers, groups of employers, and organizations. On the slide right now are some examples of those topics and the kinds of things that Chris and I are training on right now, and specifically some of the sessions we've done recently. I won't go through all those topics, but you'll have this, and we'll share a copy of the slides if you'd like to see these topics, or if you have any particular need, feel free to contact us. And if we can't help you on something, as an example, I'm not a retirement plan expert, and also I'm not a labor lawyer. A lot of the issues we deal with have some employment law crossover, but we are not experts in that area. So a lot of that stuff will refer employers or brokers out to another resource. But know that training options are available to you as an employer or to you as a broker agent, if that may be helpful. Enough said about that. Moving on to the topic of the day. Where do we stand with the Affordable Care Act? Is the ACA dead or is it still alive? Well, the short answer is it's still alive. And despite Congress's significant talk going all the way back pre-election in 2016, and despite efforts since the election and the inauguration of President Trump, effectively nothing has happened to the ACA. So I share this slide in a partly serious, partly in jest of Congress's attempts in 2017 to address the ACA. This would probably look funnier written in chalk on a pseudo chalkboard, but we've moved from repeal of the ACA or repeal and replacing the ACA with a new law to repealing it and repairing it, to repairing it, to tweaking it, to moving on. So the short story is that despite all of the media reports, despite all of the talk, all the activity, multiple votes in the House of Representatives and the U.S. Senate, nothing has happened to the ACA, and the ACA remains the law of the land. Congress is currently in an August recess, and they will convene in a matter of weeks back in Washington, but it does not seem that they will take up health care again when they convene. It appears that they will move on to tax reform. And so there could be a healthcare impact of tax reform. Certainly part of the ACA affects taxes and fees and amends the IRS code. So tax reform could address certain healthcare items. Whether they will even attempt to after the recent public failure regarding health reform, I don't know, and I won't speculate on what they will do, but it appears that they will address tax reform in full when they come back, and whether they go back and try to address the ACA and health reform again, we won't know. My guess is Congress will at some point, but whether this Congress will in the fall or soon in 2018, and as you know, 2018 is a midterm election year, I just don't know. It doesn't seem like it right now, but I'm no expert, and certainly it's difficult to project what may happen in Washington. So the big picture is this. The ACA is the law of the land. Nothing has changed. The good news for employers is that this doesn't include any kind of major change, because really all of the major provisions of the ACA were already in effect. So certainly there are provisions like the employer mandate that employers may wish to stop having to comply with, but there are no new requirements. There weren't any for 2017. They're not for 2018. They're not for 2019. The only item still on the books that would take place after this is the so-called Cadillac tax, the high-cost tax on healthcare benefits, and that remains in doubt. So whether that will take effect, even if the ACA is not repealed, is still up in the air. But anyway, nothing is urgent, and if the Cadillac tax does take effect, as currently scheduled in 2020 or later, we'll have plenty of time to learn about that and to see what kind of practical impact it will have on employers. So again, big picture, where we stand, second bullet point listed on the slide, is that without question, employers should continue to comply with the ACA, including plan design provisions, but most significantly for those employers that are applicable large employers, those that in the prior calendar year had 50 or more full-time employees plus full-time equivalents. Employers should continue to comply with player pay to offer coverage to all 30-plus hour employees to avoid potential penalties, and to offer coverage that meets minimum value standards and is affordable under the ACA rules. Also, the ACA reporting for applicable large employers and for small employers that offer self-funded or level-funded plans, those reporting rules have not changed. In fact, the IRS just in the last few weeks released the draft forms for 2017. So the reporting requirements have not gone away. And I do not think there's a reasonable basis for employers to stop compliance with reporting or any other aspect of the ACA. So the ACA still is in effect, and despite all the talk leading up to it and what may happen and what we may be exempt from going forward if there had been repeal, none of that happened. So the ACA is still in full force, and we need to comply. Now, looking at this slide, which I showed a moment ago in the third bullet point. Now, practically, since Congress didn't repeal the ACA, the next big question is, will the government continue to enforce it? And there will likely be some enforcement changes. And a common question is, well, what about the executive order that President Trump issued on the weekend that he was inaugurated in January? What impact has that had? Well, it's really had no impact so far. It didn't change the law, and the federal agencies are still legally required to enforce the law. As an example, the IRS has issued 4 different information letters over the last 3 months, I think, each of which confirmed and affirmed that the employer mandate, the individual mandate, the requirement that individuals have health coverage or pay a tax penalty, that those are still in effect, and that individuals and employers and stakeholders must continue to follow the law because the IRS is still bound to enforce it. So as of now, we haven't seen any meaningful level of change in enforcement. In fact, the IRS is, as we speak, working on enforcement of the reporting requirements for 2015 and 2016. And yes, it's taken them a while to get around to it, but as is the case with our personal tax returns, even if it takes a year or 2 or 3, they will get around to it. So we need to continue to follow the law. So again, big picture pulse check. Here's where we stand. Just to recap. The ACA is the law of the land, and employers should continue to comply with all relevant ACA provisions. There may ultimately be relief on one or more items, but that relief has not yet happened, so we need to continue to comply. Now, looking beyond that to non-ACA items, I think best practices for employers in this limbo period, and I do think it's a limbo period for employers because even though the law is clear and the ACA is still alive, I think employers are somewhat in limbo because it appears something may eventually happen with the ACA, even if it takes a while, and because we're not yet certain of the level of enforcement. So even though we know what the law is, I still think it's a limbo period, and I think that's unfortunate for those of us who are employers and advisors. But while in this limbo period, we continue to follow the law. And again, no big changes there because we know what the law is. It's no secret. There was no change in 2017. And then in addition to ACA compliance, we get back to the basics on other items. Because let's just speculate here. If there is any decrease in the level of commitment or enforcement of the federal agencies, and there are 4 federal agencies involved with healthcare reform, IRS, Department of Labor, Health and Human Services, and CMS, Center for Medicare, Medicaid Services. If those 4 agencies decrease their level of commitment or enforcement to the ACA in any measure, all that really does is provide additional resources to enforce other areas of the law. So it's a great time, even if it is a limbo period, for employers to get back to the basics on non-ACA items and to make sure benefits are being handled correctly from a tax perspective, that employers have plan documents in place for IRS plans and ERISA plans. And, those I's are dotted and T's are crossed for those matters. And that employers continue COBRA compliance. If COBRA applies to the employer as an employer with more than 20 employees in the prior calendar year, because COBRA compliance continues to be a big deal and nothing has changed regarding COBRA law. And then finally, a third point is that if your organization has not already done this, and I'm speaking not only to employers but also advisors, address any HIPAA obligations because HIPAA continues to be a big deal, not only because it's the law, but because there continue to be some rather public breaches of health information or private customer information. And you all have read about some of those in the media over the last 12 to 18 months. So to keep it simple, these are my best practice pointers. regarding the ACA and non-ACA items. Now, before we move on, I want to just give you a couple of very brief updates, because in a prior session we had shared with you that if the ACA had been repealed in full, or at least the tax provisions of the ACA been repealed, that would have had a practical impact on the plans that your organization sponsor, including health flexible spending accounts. Just as a refresher, before the ACA, health flexible spending accounts did not have an annual cap effectively, and employers could set their own cap. The ACA, beginning in the year 2013, implemented a cap of $2,500 per year per employee indexed. So the cap, for example, for 2017 plan years is $2,600. The 2018 cap has not been announced. We expect it to be $2,650. If the ACA had been repealed, that cap would have gone away, but since the ACA was not repealed, that cap still applies. Also, the ACA took away the ability for FSAs, HRAs, and health savings accounts to reimburse over-the-counter drugs or medications on a tax-free basis. So because the ACA, OTC drugs are no longer eligible to be reimbursed tax-free through any of those three accounts. If the ACA had been repealed, that would have gone away. OTC drugs would come back in as eligible items for FSAs, HRAs, or HSAs. But again, ACA hasn't been repealed, so OTC drugs are not eligible. So I just wanted to clarify that. So business as usual for FSAs. And as shown on the next slide, business as usual also for HSAs and HRAs. No changes for HSA bank account options for 2017 or 2018. The 2018 limits have, by the way, already been announced. If you have not seen those already, the minimum deductibles for high deductible health plans and HSA eligibility stay the same. The limits changed slightly by $50. For HRAs, no significant changes. If an employer wants to have an HRA plan and provide tax-free reimbursement funded by the employer for out-of-pocket medical, dental, or vision expenses, generally speaking, that the plan must be linked to a group health insurance plan. That's an ACA rule. There is, as we've previously communicated, a new option for small employers that want to reimburse out-of-pocket expenses or even premiums for employees without a group health insurance plan in place. That's the Qualifying Small Employer Health Reimbursement Arrangement, or QSE HRA. That is still in effect, and just as a side note there, that QSE HRA was established outside of the ACA. So even if the ACA were to be repealed, that option would still exist for small employers. And if you're a small employer and you have any questions about that, we'll be happy to answer that for you. In terms of some other key issues and hot topics, and I'm not going to go through all these, I've mentioned COBRA compliance and HIPAA compliance. Not for employers, but for individuals, the viability of the health insurance marketplace, healthcare.gov, and the federal or various state insurance marketplaces, the viability of those marketplaces in the current climate, and with all of the challenges for insurance carriers and with all of the uncertainty surrounding Congress and the ACA, whether that will be a viable coverage option for employers in your particular state or at the federal marketplace in 2018 is an issue right now. I mentioned earlier taxation of benefits, including certain supplemental insurance products, has been the subject of some recent IRS conversation and guidance, as has various alternative schemes or methods that some in the marketplace are proposing to employers. That there are some new models that would help employees and employers avoid significant taxation of income. And these various schemes and methods go by different names, including some so-called wellness models that are really not wellness, but are really tax avoidance schemes. And I just say buyer beware on some of those items. And if you need more information, I'll be happy to direct you, or your advisor will be happy to direct you in the right path there. And leaves of absence continue to be a hot topic, not only because of the confusing nature of leaves of absence and how employers should handle them and the impact of FMLA, but because a number of states and municipalities have enacted new required family paid leave laws, and employers are trying to figure out how to comply with the family paid leave laws and how that may interact with FMLA, or if the employer's under 50 and not subject to FMLA, how that would affect benefit elections and the like. So just want to mention those as issues and hot topics to consider and to track going forward, even though there may be nothing immediate that is needed by your organization right now. Otherwise, that's it. I just wanted to keep it brief today, and I hope that was helpful. What I'm going to do at this point is in the audio session of the webinar, and those of you that want to go, thanks for attending today. Again, we'll provide a copy of the slides and recording to you in case helpful to you or any member of your team. For those of you that have submitted a written question or would like to in the next few minutes, feel free to submit that through the question box. What I'm going to do is shut down the audio and then answer the questions in writing, and everyone will be able to see the responses. And you can even open the question box and expand it beyond the small window it is in your control panel. So those of you that are leaving us now, thanks for attending. Those of you that want to hang around, again, feel free. What you might want to do is undock the question box. There in the upper right-hand corner of the question box, there's an X that would close it out, but to the left of the X, there's what looks to be an empty box with an arrow pointing up and to the left, and if you hit that, it'll undock it, and you can use it to expand on your screen. And I'll take the next few minutes, probably the next 10 minutes, to answer some questions in writing, and I'll reply all so that you can see them. Again, thanks for attending today. Have a great afternoon and rest of the summer.